Hi, Dr. Bill here with a video newsletter blog. This one is a little bit different. I wanted to discuss my condition, which I don't like to do, but the main reason I'm doing it is to let all of you out there, all my friends, my patients, and everyone else who watches these things, to let you know where I'm at. I know it's been a long mystery journey for everybody, including myself, and I just wanted to give you a brief update as to where I'm at, but particularly to thank everyone for their prayers and for their thoughts and for their love and their kindness and the cards that I've received. I just want you to know it's been very touching and very moving to actually receive such great support. So just as a summary, I've struggled with skin cancers, basal cell carcinomas all my life. I get them everywhere in my body, and I've worked really hard to try and manage them as best I can. And I've also had a structural problem with my shoulder for over 5 years. And 2 years ago, or 18 months ago I should say, I was diagnosed with cancer inside the armpit of the shoulder basal cell. It obviously infiltrated the body. It got into where my shoulder was weak. So obviously, most of you know this already, but just summarizing, the diagnosis 18 months ago was the only option is removed with the arm. And I decided I would try alternatives to try and beat the cancer. And I've seen, would you believe, 11 doctors in that time, in that 18 months, all top specialists in their field. 8 of them medical doctors, 3 of them that were naturopathic doctors, but all top with a very good reputation. One is a professor and a sir that I've seen, who's currently still helping with me. I've tried all kinds of remedies, all sorts of things, and as you know, everyone you talk to has a remedy or has a friend who's tried something. Just because it works for one person doesn't mean to say it will work for another. Now, I had 3 scans done. The first scan showed, which was in November 2014, showed the growth. The second scan I had 11 months after that showed the growth that was growing, about 50%. Then I had another scan 5 months ago, April this year, that showed the cancer was actually reducing in size. I thought, wonderful, I'm getting on top of it. Also, the pain had been decreasing and the swelling in the arm. So I thought I was making progress. Until two months ago, when the pain became unbearable and I had to go into heavy medication, and the arm had been slowly degenerating all this time. Now the arm is totally useless, and I now have to succumb to having the arm removed because of the pain and also because of the degeneration, because the arm won't regenerate now. So even though I've been beating the cancer, I wasn't able to beat the degeneration in the arm. So what the cancer did was knocked out all the nerve supply, all the blood supply to the arm. And so it's now degenerated to the point where the pain has become basically unbearable. So I have to succumb to that operation. Now, there are many questions that you might ask and that I've asked myself. And one of them would be, why would a practitioner like me get cancer? Why is that? Well, I've asked myself that question too. Some of the questions are hard to deal with. But even though I'm not a great believer in hereditary factors, I know they do play a part. And because of my basal cell carcinoma hereditary factors, I think that's what's caused the problem. And even though I was able to start improving the cancer, I wasn't able to reverse the damaging effects of what the cancer did. So I'm fortunate to say that yes, the arm will have to be removed. And yeah, that's been very difficult for me. It's been a very difficult 2 years altogether and a very difficult 2 months, physically, emotionally, spiritually. Very, very challenging. I won't go into that. I won't bore you with that. Yes, there's been many lessons that I've learned too. So what's next after all of this? Well, we'll have to wait and see, because your perspective can change from one day to the next depending on the condition you're in at the time. So obviously when I'm in a lot of pain and miserable, my perspective's not very good, but I'm expecting that once I have the arm removed and get the pain from the operation under control, then I'll be a new me. And I still have, even though I'll only have one arm, I'll still have my brain, and I'll be putting that to good use. So my wife and my family have been absolutely amazing, as have my friends, and I thank you all, and look forward to working with you further. It's Dr. Bill signing off. Thank you.